Hello and welcome to the Integrated Rehab and Performance Podcast. My name is Dr. Nick Curtis and I'm running the show here at the Integrated Rehab and Performance Center. Today we have another golf-specific episode. This is Golf Podcast episode 18, and we are learning about the lower quarter rotation test. This is TPI's, or Titleist Performance Institute's, lower quarter rotation test. It is one of the 15 movement screens that we do on golfers to help give us a good idea of how their body is moving and how well it is equipped for the golf swing in regards to mobility, power, and longevity. So the lower quarter rotation test, as you can probably tell, what we're testing the pelvis down to see how well the golfer is able to rotate, that is in the backswing and in the downswing. Do we have enough movement variability to access the positions that we need to in order to achieve a powerful backswing, not have to compensate to get into these positions, and be able to do that consistently without creating pain, right? So longevity is involved as well, right? So the first question is, what is the lower quarter rotation test? First thing we need is something to measure out 60 degrees. So what we can use here is the lie angle of a 6-iron, which stock should be about 60 degrees. And I have a video that helps demonstrate how we do this test, but to describe it, we need to determine what is 60 degrees, and then we're going to use that as a reference. So we stand perpendicular to our 60-degree reference. We're going to place all of our weight on one foot. We're going to stand as tall as we can on that foot, no bending the knee. From there, what we want to do is pick a leg. And then if we're starting with the backswing, what we do is we rotate towards our right, and that's where we need our 60-degree angle to be opened up to. And we are seeing, can our pelvis down break that plane? So we're measuring at the pelvis, does it break that 60-degree plane or come equal to it? And that is kind of our first goal for this test. If we're not able to pass that on one leg in the backswing or the downswing, then we know we need to either work on external or internal rotation of that side regarding which way we are turning. Okay, and you'll see that in the video that I'll show here in a second. Now the same thing with the opposite leg. In this test, we stand up as tall as we can, no bending the knee, and then again we rotate, checking backswing mobility and downswing mobility on that side. So it's a really useful test here because we get to see specifically, do we have access to what we need for the backswing? Do we have access on that same leg for the downswing? And then same thing on the opposite leg. So we get to check both directions on both legs. And if we are not seeing the numbers that we need, then we know that we need to take a closer look. Again, this is a screening test. It does a really good job of understanding generally, does the golfer have access to the different things we need, stability where we need it, mobility where we need it. But when we do have some of these findings here at Integrated Rehab and Performance Center, we always dive a lot deeper down into the weeds to figure out exactly what's going on at every single muscle, ligament, tendon, bone, whatever it might be. We know exactly what's going on. So this test will tell us, hey, how close do we need to look at the pelvis, hip, knee, and ankle? All right, so let's go ahead and take a look at what this lower quarter rotation test looks like. The lower quarter rotation test, if we have a 6-iron, what we're going to do is use the lie angle of the 6-iron, like this here, to help me gauge your rotation measurements. So if we take this angle, we'll lie the 6-iron down, and then we have another club or a broom that we're using to get that angle. Now, if you stand perpendicular to that 6-iron, what we're going to do is raise one foot, doesn't matter which one to start, and we're going to put all our weight in the ground foot. From here, we're just going to rotate towards, in this case, our left, staying tall through our hip here. Okay, no bend in the knee. We're not rotating through like this. I want to see if we stay as tall as we can, how far we rotate, and then we're going to do the same thing with our opposite foot, staying tall, rotating in that same direction. What we'll do after that is we just flip from here, and again, we're using the lie angle of the 6-iron, which is about 60 degrees, to help me gauge how far you're able to rotate. So again, we'll raise one foot from here. We're going to rotate as far as we can there, staying tall in that ground foot, doing that same thing here. So Nick, we'll have you try that. First, we're going to rotate towards our right. So he's perpendicular to the 6-iron here. He's raised one foot up. All his weight is in this ground leg. He's going to stay as tall as he can through there, and then he's going to rotate towards his right. Never shifting any weight onto that up heel. Good, and then let's switch foot. Staying tall as he can, rotating through, keeping his foot completely flat on the ground there. Great. Now what we do there is we switch back. I now have my angle markers, and from the video, it's about hip height, face on. I can see how far you can rotate towards in your lower quarter here. Great. So that was the lower quarter rotation test. Now we talked about already how we are measuring the left side versus the right side and the downswing versus the backswing. Another thing, a component that's really important that starts to tie into this here is the kinematic sequence. So not only do we need access to range of motion here at the lower extremity, but we need to know, do we have enough, but also can we create separation from our lower half, right? So our lower quarter from our thorax. What that tells us, what that's necessary for, is that kinematic sequence where we need to be able to create separation from our pelvis to our thorax, right? And I'll demonstrate that here in a video where you can actually see kind of what I'm talking about. But again, what this is describing is that kinematic sequence. Any golfer in the world, you might find different swing characteristics, some that you might say are undesired, but we have professionals and champions that have these swing characteristics. Others that we might think are that you need to be a good golfer, and some that don't exactly demonstrate that swing characteristic. But if there's one thing that is consistent between all great athletes and golfers, it is this kinematic sequence, which is the timing and the speed of the different components of the body. So we talk about the pelvis, the thorax, the arm, and the club or the hand, right? And so all of these need to move in a certain sequence if they're going to move at all, which will create that consistency, right? The consistency and the power that we need as golfers, right? So check out this video here where you can visually see the kinematic sequence and why it's important for the lower quarter rotation test to be hitting the numbers we need, because we don't just need to have that mobility in there. If we don't have the mobility in there, then yes, we need to improve to be able to get in these positions. But that also means that we can't create separation from our pelvis to our thorax or our thorax to our pelvis. So again, kind of the low-hanging fruit here, if we don't have access to that range of motion, then we're missing out on both things. We need to make sure that we're working on our lower quarter rotation if this test comes back positive. Okay, so what is the kinematic sequence in the golf swing? Kinematic sequence is the one thing that translates between any of the top golfers. Though they have different swing characteristics and different things you might see on video, there are some things that are consistent between all the great ball strikers. One of those things is the way the body moves and the order in which it moves. Okay, so one important thing in the kinematic sequence is understanding what moves first. We're really going to start here mostly at the top of the backswing. So once we get to the top of the backswing, what moves first as we start to come back down? The answer is the pelvis. There's four things we're looking at: the pelvis, the thorax, the arm, and the club. Okay, so what we want to know at the top of the backswing is, can you create separation from your pelvis and your thorax? Because we need one to move relative to the other. We also need to make sure that it's the pelvis that's moving first. Once the pelvis starts to move, it's also the first to start to slow down, because as the thorax comes around, this starts to slow down as it slingshots our thorax. Next, after the thorax, to start moving, is going to be our shoulder. We need to make sure we have good shoulder range of motion, that we can get into that last end range piece of motion here in this right or backside shoulder. So after our pelvis stops, our thorax comes along, and then it's our shoulder that will start to move as well. And the last to get slingshotted is the hand and the club. That's the kinematic sequence in the golf swing. All right, and so a little bit more, if you want to learn more on this idea of the kinematic sequence and separation of the pelvis from the thorax and vice versa, check out golf episode 4, the pelvic rotation test, and golf episode 5, the torso rotation test. What these tests do is they look at each part individually, and it is specifically testing for separation or ability to separate one from the other. Right, so these are tests that we do early on in the TPI sequence, which they're not quantitative or quantitative tests where we're not looking to see certain number or range of motion measurement, but we're just seeing qualitatively, are you able to control and separate these two components? So very important. Again, that's golf episode 4 and golf episode 5. I have links to those in the description here on Spotify and YouTube, as well as the companion article has a link where you can go to find these articles as well. And again, that is the companion article. I'll link that down. That's on the blog. And if you're interested, you can sign up for the blog where you get these articles and blogs sent right into your email every Monday, depending on the topic of the day or of the week. And there's an archive of that on the blog page of the website. So go ahead and check that out. Now, how can we fix this lower body mobility issue if we're finding that we're not able to get a certain amount of mobility, the number that we need on either side, whether it's internal rotation or external rotation of the hip? Then we have this kind of a sequence of exercises that we can give you. Now, again, these aren't perfect because we don't, they're not specific to you, but generically, you can try these at home to try to make these improvements based off the findings that you had on your lower quarter rotation test. So the first one here is addressing hip internal rotation in the golf swing. Okay, so we're just going to work on both sides, hip internal rotation. If you found that one side, maybe your back leg and the backswing had you lacked range of motion there, then you're lacking internal rotation on that leg, then we can focus these exercises that are unilateral or have the capacity to be done only on one side, which is a few of them, then maybe just focus on that side, right? So I will show you the videos of each where we have two exercises we can try to improve internal rotation specifically here at the hip, and that is the 90-90 hip lift and the adductor pullback. Right, so I will link those videos, or I will show those videos in their entirety and how to perform those right now. And then if you have more interest in learning what is hip internal rotation, what are we talking about here really, there is an article on the blog that I have written for that. There's no podcast on it, but there's an article, and I'll link that again down below. It is called What is Hip Internal Rotation? That is the name of the blog art, and you can find that on the website, and again, I'll link that down below. All right, this is the supine 90-90 breathing exercise. For this, we're going to use a foam roller or a small ball between our knees. This just helps keep our feet in line with our knees, in line with our hips. And from here, just a subtle lift of the tailbone off the floor. We want to keep belt line touching the floor here and our low back on the floor as well. And then we just maintain this position as we breathe. And again, the breath is really important for this. We're going to take a big breath in through the nose and then all the way out through the mouth. But we want to think of letting the air kind of fall out of our mouth. It's a long exhale. You should feel the ribs starting to come in towards each other and the obliques starting to work hard to do that as we push every last bit of air out. So again, tailbone comes off the ground. We use our hamstrings to just peel the tailbone off the ground. Our heels are digging into the wall and pulling down. That's what activates the hamstrings there. And just use that contraction to slightly lift the tailbone off the ground. Big breath in through the nose. Let that air fall out of your mouth on the way out. Feel the ribs come in toward each other. Maintain that contraction. Maintain that rib position as you breathe back in through your nose. And then again, exhale. When we get to the end of our exhale, just check, make sure that the hamstrings are still working. Make sure the tailbone is slightly peeled off the ground there. And make sure our heels are still contacting the wall. The toes should be pretty loose. We want a full foot contact. We want most of the contact being through the heels as we're tugging down on the wall. And then we're just repping that out. Give it a shot. Okay, this is the adductor pullback exercise. We're going to usually perform this exercise only on one side. Just follow your programming to determine which side that we want to do that on. So in this case, if I'm laying on my left side, I'll be working the right side adductor. That's kind of the target hip in this case. Our positioning is going to be 90 degrees at the hips. We're going to stack the shoulder in line with the hip here, and we want to make sure that we don't have any extension of this low back like that. We want a good rib tuck without our upper sternum crunching like that. So just a good rib tuck down, keeping our hip in line with our shoulder and our hips on top of each other. I have a little foam yoga block here. You don't need this, but typically if we have our feet raised a couple inches off the ground, that helps. And then a full foot contact with both feet on the wall. So those are key points. We have our hip in line with our shoulder. Hips are stacked. Shoulders are stacked on top of each other. My head and neck are relaxed.
I can use a pillow here if you'd like to. And then same thing, we have a full foot contact, both feet into the wall. I feel both big toes in the wall. I feel both heels into the wall, and I feel both inner arches of my foot in the wall. Now from here, I have a ball that I'm going to use to place between my knees. You can use a towel if you need to. You don't need to use anything at all if you don't have anything. But from here, I'm just going to practice moving my hip forward and then backward, stopping before my low back really gets involved. And again, keeping my full foot contact the entire time. From here, this is where the drill starts. What we're going to do is we're going to exhale through the mouth, like we're fogging a mirror. Exhale all the way out. Feel those ribs start to tuck and internally rotate through there. Hold that tension in your obliques. Inhale through the nose. That's going to be our breathing throughout this drill. So slow breaths in through the nose, long breaths long breaths out through the mouth, keeping our full foot contact and our hip and shoulder positioning. From here, we're going to pull our top hip back as far as we can before we start to get upper body involvement. Then from there, we're going to apply pressure directly down into that ball, maybe a 3 or a 4 out of 10 pressure there. You should feel your groin on this top side working hard. Otherwise, we want the rest of the body to be relatively relaxed. Okay. Another key point here is we want to keep our top side hip pulled down towards this wall where our feet are. So again, this is part of our setup positioning, is we have full foot contact, our hips are in line, our shoulders are stacked, but we also want to pull, or at least think about pulling the top hip down towards the wall there. Okay, that should create a little bit of space and oblique action here on this bottom side. So we're creating some space there, thinking about pulling that hip down, and then we can pull that hip down, pull this hip in, keep that in tension as we push down. I'm pushing down into the wall. So the whole time I'm pushing down, I'm pushing in, and I'm thinking about pushing this hip down towards the wall. From here, we do our breathing cycles. One breath is one rep. So nice and slow, keeping those ribs tucked. Go ahead, give it a shot.
All right, and how do we address hip external rotation in the swing? Again, say for instance your back leg was having issues when you were rotating not towards that leg but towards the opposite side. So if it's your back leg when you're righty, when you were rotating towards your left, if you weren't quite able to make that 60 degrees of rotation there at the pelvis, then this is something we might want to work on. We're going to work on external rotation, and we can again focus on that specific leg you notice it on for these exercises here that are able to be done with one side. So again, we're going to do that hip 90-90, that 90-90 hip shift again here for external rotation. This is something it's done on both legs, right? So you just go ahead and do the drill. This helps set that pelvis back into a neutral state. That's why we're doing it for both, because whether we're lacking external or internal rotation, first thing we need to address is pelvic orientation and get that thing back into a neutral state. From there, that opens up a whole lot of range of motion, and then we just got to kind of hone it, right? And that is what exercise 2 here for external rotation is for. That is side-lying foam roller drill for external rotation. Okay, so I will let these 2 videos play, and again, we have a article written that is titled "What is External Rotation?" You can find that on the blog section of the integratedrpc.com. That's the website. And again, that's towards the bottom. It is "What is External Rotation?" Helps explain a little bit more about what that movement is, just in general, which is a space-creating motion. Again, if you want to learn more about that, you can read that blog article.
All right, this is the supine 90-90 breathing exercise. For this, we're going to use a foam roller or a small ball between our knees. This just helps keep our feet in line with our knees, in line with our hips. And from here, just a subtle lift of the tailbone off the floor. We want to keep belt line touching the floor here and our low back on the floor as well. And then we just maintain this position as we breathe. And again, the breath is really important for this. We're going to take a big breath in through the nose and then all the way out through the mouth. But we want to think of letting the air kind of fall out of our mouth. It's a long exhale. You should feel the ribs starting to come in towards each other and the obliques starting to work hard to do that as we push every last bit of air out. So again, tailbone comes off the ground. We use our hamstrings to just peel the tailbone off the ground. Our heels are digging into the wall and pulling down. That's what activates the hamstrings there. And just use that contraction to slightly lift the tailbone off the ground. Big breath in through the nose. Let that air fall out of your mouth on the way out. Feel the ribs come in toward each other. Maintain that contraction. Maintain that rib position as you breathe back in through your nose. And then again, exhale.
When we get to the end of our exhale, just check, make sure that the hamstrings are still working, make sure the tailbone is slightly peeled off the ground there, and make sure our heels are still contacting the wall. The toes should be pretty loose. We want full foot contact. We want most of the contact being through the heels as we're tugging down on the wall. And then we're just repping that out. Give it a shot.
All right, this is a 60-degree foam roller for top side hip external rotation. We're also getting some bottom side hip internal rotation when we do this as well. So for this drill, what we're doing is we're laying on our side. We're gonna get into a comfortable position where we're resting our head into our hand here. We want our shoulders stacked with our hip, and we wanna make sure that we're avoiding any extra rib flare through here and low back extension. Make sure to tuck those ribs down. Try to keep a nice straight line from your ribs to your hip. And here to help you do that is just take a big long exhale through the mouth. So you exhale, you feel your ribs start to tuck down and in. You'll feel your obliques start to work. I want you to hold some of that tension in as you breathe back in through your nose. And that keeps those rib cage from flaring back out. So we keep everything nice and tucked. From there, we can be at a 60-degree-ish angle at our hips. And what we're going to do is roll this top hip forward on top of the bottom hip. Okay, we want to stop right before our low back tries to get involved, and we start turning our whole body like that. Make sure that we keep a nice rib tuck position, and we're only getting motion here through the hips. Even if it's only subtle motion, that's fine. Everything else should be relaxed. So we pull that hip back in, and then we roll it back out on top. Nice and slow. I'm going to breathe in. Can exhale. And we're just opening up those hips, creating and encouraging some external rotation on the top side hip, and we're even getting some internal rotation on that bottom side. All right, go ahead, give that a shot.
All right, and then to put all these things together to kind of integrate that internal and external rotation into one kind of fluid movement, we can try this drill here, the 90-90 thoracic rotation drill. I will show that that exercise here now. It's a great drill to start incorporating some lower body with a little bit of upper body, so we know how to separate those two, right? We just kind of improved our range of motion here in the lower body. Let's make sure that we can use it while we do something different with the upper body, right? So some motor control practice there as well as improving our upper body mobility at the same time. So there's some components to this that really mimic a golf swing quite well. So go ahead, I'll show that video here, give that a try. Okay, for this thoracic rotation drill, we're actually getting a lot to happen here. So in this position, we have our left foot forward and our right foot back. Our hips are at 90 degrees in either direction, and our knees are at 90 degrees. So if you can mimic this 90-90 kind of shin box position, is what it's called, then that's a great starting point. What we're getting here is external rotation of that left hip, internal rotation of that right hip. Now, this might be a little bit difficult for some of you to get into this position. If so, we can just work on, first of all, getting into this position. The more we can improve that, then the better our golf swing, right? Because we need to get into the backswing, left side external rotation, right side internal rotation. That's exactly the position we're in here, right? So we're getting that reciprocal motion where one side is doing one thing and the other side is doing the opposite. Now, where we can upgrade this and turn it into a thoracic rotation drill is we hold this ball. If we don't have a medicine ball, then just think about kind of giving yourself a big hug and creating tension in that way. And we're going to rotate towards that backside leg. So in this case, we are rotating towards that backside leg, and we're just kind of hanging out in this position. Now, what we need to do next is just own this position. So you should imagine yourself, we're going to breathe in through the nose, nice and slow. Breathe out through the mouth. Let the air kind of fall out of your mouth. Again, we're going to take a long time on these inhales and exhales. Own this position here where we're rotated towards our right side, and feel the tension start to build in your abs as you're pushing out every last bit of breath there, right? That's really important. Feel your abs start to turn on a little bit. Maintain that tension, 2 or 3 out of 10, and then breathe back in through the nose, maintaining that tension. What that does is that forces our ribs to internally rotate and kind of close down on each other. And then as we inhale, but maintain all that tension that we've built with the abs that are actually pulling those ribs in those positions, is that we keep those ribs down, and then we inhale, and we're teaching the diaphragm, we're teaching that thoracic spine, we're teaching those hips how to exist in this position as we breathe in and out, right? So that helps with the brain. It also helps with the tissue that are controlling these joints to start to get used to and actually adapt to these positions here. Okay, so we start chest facing forward, we rotate towards that backside leg, and then from there we breathe, breath in through the nose, breath out through the mouth, maintain that tension, another breath in through the nose, and then we can rotate back facing forward, and then we can rep that out. Just repeat that 4 to 5 times, kind of owning that rotation. Again, trying to get a little bit more rotation each time, but also trying to make sure we're standing up as tall as we can and standing tall as we do it. Right, so a great drill to get everything working together. We are in a perfect backswing position here, though it doesn't look like it. We have our left hip in external rotation. Our right hip is absorbing that external rotation, creating internal rotation on the right side, and then we are rotating our thoracic spine to the right. Again, try this in both directions. It's important to try to maintain some of that symmetry, especially in a sport like golf where we tend to be so asymmetric. That leads to that pain, that discomfort, that overuse, right? So as a pain prevention, kind of prehab, make sure to do it on both sides, and then the same thing on the rehab side, we do it on both sides, but just make sure that we are getting it, and especially paying attention as we rotate towards our right with our left foot forward and our right foot back. All right, and so to conclude, that was the lower quarter rotation test. It is an important part of the TPI golf biomechanics screen. It gives us a good idea what's happening in that lower extremity and pelvis, and then where we stack up to compared to what would be optimal lower extremity rotation. Right, and that's at the pelvis, hip, knee. There's some subtle rotation there at the knee and the ankle. Right, make sure that we have good connection between the ankle, the foot, and the ground. Now that being said, it is vital to take a closer look at individual components after we do this screen. So like I said, there's a lot of different joints involved. If we're showing that we're not getting quite enough range of motion here, that we'd like to see a little bit more to affect those things that we talked about earlier, consistency, longevity, and then power. Then we have to take a closer look, a much closer look to see what's really going on. But otherwise, if you're trying out this drill, give these exercises a try, right? Check out the article to learn a little bit more. There's a little bit more description in the article there. Again, I'm linking that below. But it's a great screening process to try to see where you stack up, and then we can go from there. All right. If you have any other questions, don't hesitate to reach out. contact@integratedrpc.com is the email. The website, integratedrpc.com. There's ways to reach out there as well. I look forward to hearing from you guys. And again, if you have any questions, don't hesitate to reach out. Thanks. Bye.